So yes, good morning, good afternoon, everyone. Thank you so much for taking time today to come and attend our webinar from the Asian Health Coalition titled Tools for Wellness and Mental Health for Asian Pacific American Library Workers and Communities. First, I would like to thank the Apollo Program Committee, Jamie Karamaji, Melody Rude, Elaine Tai, Susie Lee, Fanny Uying, and Crystal Chen for all their hard work planning all of the Apollo programs for this year. And next, I'd like to introduce our presenter, Nishita Conjeevaram. She received her bachelor's in Spanish and her M.P.H in health behavior and health education from the University of Michigan. Nishita is the senior program manager of the behavioral health team at the Asian Health Coalition and is also involved with the Asian Engagement and Recruitment Care Medical Student Ambassador Project for the All of Us Research Program. She works closely with medical students and partner community-based organizations across the country to implement various projects that serve the Asian American, Native Hawaiian, and Pacific Islander communities. And so with that, I am going to pass the mic over to Nishita.
Thank you, Annie, for that introduction. And thank you so much, everyone, for attending today. I'm really excited to be here and to spend the next hour with you all talking all things mental health. So I appreciate you being here again, and let's go ahead and get started. I'm going to share some slides. A quick disclaimer, there are going to be some topic areas that might be sensitive. Mental health, while it is a topic that needs to be talked more about and highlighted, can also be really sensitive. And I want to be mindful of that and mindful of how you are all feeling. If at any point you feel uncomfortable or need to step away and come back, please know that you can do that. But I thank you all for your time, and I hope you do stick around for all of the material because it is very important to learn. Again, we will be covering tools for wellness and mental health. I'll be referring a lot to the mental health resource guides my organization has developed. And at the end of the presentation, I'll also be sharing some resources and links for you to be able to access those guides and download them to utilize after the session has ended and moving forward into your work and personal lives. So let's go ahead and start by defining what is mental health. So this is a very important part of our overall health and well-being. It is also very closely related to our physical health. Both influence one another. But mental health includes our emotional, psychological, and social well-being. It also helps us to determine how do we handle stress, how do we relate to others, make healthy choices. And it is something that occurs and we are made aware of from a very early age and develops into adulthood. So I want to start with asking you all some questions just to get a general idea of how much do we know about mental health. So Annie, if you could go ahead and start the poll. We'll start with the first question. So how many adults experience mental health illness each year? One in how many adults? So go ahead and take a few seconds to submit your answers. What do you think that number is? Annie, I don't think I can see if people are answering this on my end, but you can go ahead and
okay.
Let me know. Okay, so average response is saying 1 in 4 adults. Let's go to question 2. How about for how many youth? How many youth experience a mental health disorder each year? And we can share the responses once everyone has answered. 1 in 6. All right, so you all did a pretty good job. Let's see what the responses are. So 1 in 5 US adults experience mental illness each year, and majority of you got the statistic for youth correct. 1 in 6 youth aged 6 to 17 experience a mental health disorder each year. So it is quite common in this country, yet it is not talked about enough. There is such a stigma attached to it. And if someone is struggling with mental illness, it can feel very isolating. But it's important to bring awareness to the data like this, to talk about mental health in more spaces and bring this up in conversation with family, friends, those in our community, so that we can normalize it and make people who are experiencing mental health challenges feel less alone and know that there is a community out there for them. So what does mental health look like specifically within the Asian American community? Asian Americans are 3 times less likely to seek help for their emotional or mental health concerns compared to white Americans. And suicide is the 10th leading cause of death for Asian Americans. Specifically, Asian American women aged 15 to 24 and 65 and older have the highest suicide rates among women across all racial and ethnic groups. Many refugees from war-torn Southeast Asian countries suffer from mental illness, particularly 50 to 70% suffer from post-traumatic stress disorder, 40% from depression, and 35% from anxiety. So mental health is prevalent in our communities, but again, we are 3 times less likely to seek help. And that's because there are so many barriers in place that are preventing us from seeking that help, taking that step to get care. So I want to launch my 3rd and final polling question, which is, what do we think some of the barriers are when it comes to seeking mental health care? People might be aware that they have some challenges or something is going on, but what's preventing them from seeking that care? Go ahead and take a few seconds, submit your responses. All right, we were close to 100%. The answer is yes, D, all of the above. All of these play a role in preventing people from accessing care, specifically within the AAPI community. One of those primary barriers is language. Overall, 32.6% of Asian Americans are not fluent in English. This can be extremely difficult when trying to find mental health providers who do not speak the language, who do not have translation services available, and who also don't understand the cultural context and background of the patients they're serving. It's also extremely difficult to find mental health providers generally, let alone find mental health providers that are Asian American and Pacific Islander. Stigma is also a huge barrier that was listed in the polling question. Not only is there this idea that mental health is something that is not talked about, to be ashamed of, makes you seem weak. There's so much stigmatizing language around how various communities talk about mental health, calling people crazy, insane, etc. There's also a general lack of knowledge about mental illness. So people might be experiencing symptoms that are related to mental illness, but they are not aware that that's what's happening. So that's why it's super important to continue educating others about mental illness and raise awareness. Finally, one of the barriers not listed in the question I asked you was the model minority stereotype. And this is something that has really been talked about, especially in recent years after the COVID-19 pandemic. But it's this assumption that is portraying Asian Americans to be more successful, to be financially and academically highly achieving, conforming to social norms. And there are these pressures that are created by this stereotype that can prevent community members from seeking mental health care, because we should be doing well, we should have access to resources, so why would we have mental health issues? When clearly the data is showing that that is not the case. So when we think of mental health professionals, what comes to mind? What are different types of mental health professionals? And I encourage you all to type in some responses in the chat box. When you think of a mental health professional, who do you think of? Yes, therapists, counselors, who else? Psychiatrists, social workers? Yeah, exactly. These are all great responses. So let's go through some of them in more detail. So the first one I'm going to bring up is actually primary care physicians. When people first start to develop mental illness, they're probably going to go to their primary care physician first for help, because in general, we tend to go regularly for routine physical checkups. So this can be a great opportunity for someone to have an assessment done and ask questions about mental health first. There's also less stigma around taking care of our physical health. So by going to a primary care physician, it's a good gateway or entry into talking about mental health and then being referred outside to other mental health professionals. But PCPs can provide immediate support and connect people to mental health specialists. They can also provide medications for mental health disorders. You all mentioned psychiatrists. So these are medical doctors that treat people with mental health disorders and can provide medication. They can also explain how various medications interact with one another, and provide assessments on mental health conditions. Psychologists are another form of professional mental health professionals, and they can provide counseling services, treat mental, emotional, and behavioral disorders. While they are not doctors, in certain states, psychologists can prescribe medication as well. We also have mental health nurses. So these are nurses trained in mental health, and they can give medication and recommend treatments with physician supervision. So again, if community members, if you yourselves, family, friends are uncomfortable going to see a mental health professional first, going to see a nurse, a primary care physician can be a great starting point. A lot of you mentioned social workers. Yes, these are counselors with at least a master's degree in social work, and they're trained to make diagnoses and provide individual and group counseling. They can also provide case management. There are licensed professional counselors as well that can provide counseling, and they're trained to diagnose and provide treatment recommendations. Therapists also that are specialized in various treatments, such as individual therapy, group therapy, marital and family therapy. And then last but not least, we have certified peer specialists. So these are individuals that have lived experience with mental health or substance use challenges. They assist clients with recovery by being able to recognize and develop their strengths and help them to set goals to get on that path to recovery. So now let's think about treatment. So we have all of these mental health professionals available to us, but what are the types of treatment that they are providing? Again, feel free to type in the chat box your ideas. When it comes to mental health treatment, what are those things that come to mind? Medication, therapy. Yeah, exactly. What else? Individual and group therapy. Yeah, great. You all are getting all of these correct. So a very common one, oh, I see. Community care, acupuncture, exercise. Yeah, so those are all wonderful forms of self-care, which we will talk about in a little bit. But when we think about treatment specifically, what will your mental health professional be prescribing to you. We think about things like therapy, recovery support groups, medication. So let's go into that in some further detail, starting with psychotherapy. So this is treatment provided by a trained mental health professional that helps you to explore your thoughts, feelings, and behaviors. As you can see here, there are different types of therapy that work for different people. So individual, it's you and the therapist one-on-one. With group therapy, 2 or more patients that have similar mental health challenges. There's marital or couples therapy, and then also family therapy. So with family therapy, this really helps family members to understand what is going on with their loved one, what are they experiencing and feeling, as well as how they themselves can cope while their loved one is living with mental health challenges. We have support groups. So these are group meetings where members guide each other towards a shared goal of recovery. These are often comprised of non-professionals, but those in the group have lived experience. We have medication, as you all touched upon as well. And then recovery support services. So these are things like AA, such as a 12-step program that provides a community setting for, again, fellow recovering persons with shared lived experience to be able to provide mutual support and guide each other through the road to recovery. So we know a lot about these things, but again, there is such a hesitancy to actually seek care, to talk to a mental health professional, to even consider taking medication for a mental illness. So I think it's important that we go through some of those myths and debunk them together. A common misconception with medication is that people who need medication for mental health are dangerous. People with mental illness, including those who take psychiatric medications, are more likely to be targets of danger and violence rather than cause it themselves. They're also more likely to harm themselves than harm other people. So there's a negative stereotype attached to mental health related to having certain disorders and equating that with violence. But again, it's important to understand that the opposite is in fact true, and taking medication does not mean that you are violent. That does not mean that you are a danger to others. It means that you are taking the agency to take care of your mental health. Another common misconception or again, stigma that's associated with mental health and specifically taking medication is that this is a sign of weakness. Medication is not a sign of giving up, taking an easy option or a way out. This can actually be a very effective way to help people move through and problem solve their way through mental health challenges whenever they are experiencing difficult times. So again, this is a sign of strength, of taking agency to take care of your own health. This is in no way me recommending medication. Every situation is different for every person, but if that's something that you talk about with your provider, that friends and family, community members talk about with the mental health professional as a good step for them, it can be extremely beneficial. And another common misconception is that once you start taking medication, you have to be on it for life. So most people that take medication are only doing so for a limited period of time. Again, for each and every person, that looks different as to how long that is. However, the earlier you start medication, the earlier you seek treatment generally, the sooner that you are on that road to recovery, that those outcomes are improving for you and that you can hopefully get off of medication. So again, this is usually not something that is intended to be a lifelong thing, but it's dependent on that person and the conversations they have with their physician. There are also common misconceptions when it comes to therapy. So let's cover some of those as well. One is that everyone will find out about my problems if I go to a therapist. So this idea that there is no privacy and that others will be finding out that they have an issue. Again, this is tying back to that stigma related to mental health, and especially within AAPI communities, there's this concept of, having everything, your personal business, stay within your own family. You don't talk about it with other people. You don't want to bring shame to your family by talking about issues like mental health, and others might view you negatively if you admit to that or if they find out. So actually going outside and seeking professional care can be really scary for people because of that stigma, because of that shame and embarrassment. However, it's important to educate those around us that therapists are required by law to keep things confidential. That's part of the oath that they take. So confidentiality is guaranteed, and you can trust that your therapist will not disclose personal information. Another wonderful option that's become increasingly available to us, again, especially during the time of the pandemic, has been telehealth. So if there is a concern of going out in public and going into a doctor's office, you can access mental health therapy in the comfort of your own home, where there's even more privacy. Another myth is that we don't need therapy because we have friends and family. And it is super important to have that support system that does benefit us and our mental health. However, there are times where you find that you can't always talk to people about everything, especially those that you're closest to. Sometimes disclosing certain information about what you're going through is hard because you don't want to hurt their feelings. But when you meet with a therapist, you have this space to share your true feelings and be 100% honest without having to feel like you need to edit what you are saying or hurt anyone. Another common myth is the belief that we don't need therapy because we don't have serious problems. So there's always a benefit to seeking mental health services and support. And actually, the longer we wait for those mental health symptoms to worsen, the longer it'll take to recover from them. So we don't want to discount what we are going through, what we are feeling. Just because we don't have a diagnosed disorder does not mean that we don't deserve or need or can benefit from therapy or other support services. Again, the sooner we are connected to care, the better the outcome will be. This goes hand in hand with the last myth that is quite common, which is related to couples therapy, that this is only intended for those heading for divorce. This is actually beneficial even if you are in a healthy relationship and you don't have any current major challenges going on, because you're able to resolve and work through feelings, develop better communication skills, and maintain your relationship to prevent things from worsening. But how do we know when to seek professional help? So again, the earlier we are connected to care, the better. There's no harm in going to seek help from a therapist or to talk to your doctor or social worker or whoever it may be about what you're going through and what treatment options are available. But how do we know when it really is time to seek professional help, when things have progressed to a point where we shouldn't wait any longer? This is where we need to be honest with ourselves and monitor these things, but also these are signs and symptoms we can be aware of to look out for community members, to look out for our family, friends, those around us. Feelings of fear, anger, sadness, frustration, if we notice significant changes in appetite, energy, activity levels, difficulty concentrating, sleeping, physical reactions. Again, physical and mental health is very closely tied together. So sometimes a physical reaction from our body, we might go into a doctor's office thinking there's something going on with their physical health, but it could be a sign of a mental health challenge. So things like headaches, body pains, stomach problems, rashes, worsening of existing chronic health problems, and then also increase in substance use. If any of these things are happening for more than 2 weeks consistently, then it really is time to reach out to a professional and to see what's going on and to see what your next steps should be. Now, if you yourself are not struggling with mental health challenges, but you notice these changes in behavior, in feelings, in appearance around your loved ones, around those that you are serving in your work, how do we bring up a conversation to provide support? How do we talk about mental health and check in with those people? Because again, it can be uncomfortable. We could be afraid that they take things the wrong way or won't open up to us or will get mad. So these are just some various things to keep in mind when we are starting that conversation. One, definitely check in if we are concerned about someone, and we can do so in very non-threatening ways. It could be a simple text message like, hey, just want to make sure you're doing okay, or hey, let's go grab a cup of coffee. Something that invites them to engage in a conversation with you without openly saying right away, hey, I think something is wrong with you, or I think you're experiencing mental health challenges. How can I help? Because that automatically can put people on the defense. So opening up a conversation in a gentle and non-threatening way, and just letting them know that you care about them is a great way to then encourage that person to open up. We also want to practice listening non-judgmentally. So we need to give that person the space to explain what they're going through and not to try and make any assumptions about their experience based on what we've read about or what we've seen in others or what we've experienced ourselves. So we could be having the same symptoms or experiences as that individual, but we can't really determine that that experience is identical to ours or that what has worked for us will work for another person. So just be there to listen, to validate their feelings, avoid making the conversation about yourself, and also ask questions that allow for that person to expand on what they're already telling you about. So examples that you can see here on the screen are things like, how have you been feeling? Or what's that like for you? Or can you tell me more about that? Again, avoiding things that result in just a yes or no answer, but allowing that person to continue sharing and opening up. Number 3 is probably the biggest one and most difficult when we want to check in and provide support for loved ones, is to remain patient, because it might not be that first conversation where someone is opening up to you and wanting to talk right away. We need to know that it might take some time for people to feel comfortable talking about their emotions, being vulnerable, sharing, or even being aware that they have challenges in the first place. And it's totally understandable that they might not open up right away. And we need to make sure that we're not taking that personally, but be consistent, be patient, just let the person know that you are there and ready to talk whenever they are ready. And then over time, once that trust is established, once they feel more comfortable, they will come to you for support. Also, make sure to be yourself. Sometimes when we are going through challenges, we fear that people will treat us differently. And that could be the case. If we know someone is struggling, we might act weird around them or extra nice or do things that we normally wouldn't do. So having a sense of normalcy is also important if someone is struggling with mental health challenges. So, you know, inviting them to the same social activities you usually would, or if you typically go out for dinner or catch a movie together, still do that, even though you know that they are struggling or going through challenges. Make sure you are checking in on them, but don't lose those other activities that you normally do. Last but not least, ask them how you can help. So we don't need to come in again with our own assumptions or preconceived notions of what they need or might want from us, but ask them, how can I help you? What do you need from me? That could be a regular check-in or not. It could be that they just need help with practical things. Sometimes having mental health challenges prevents you from doing day-to-day tasks like keeping up with your garden or cleaning or walking the dog. So asking that individual how you can help and really listening to what they're saying and making sure we can provide that for them is a really, really good way to build that trust and allow for them to open up whenever they are ready. So this is a topic area that can be quite sensitive. Again, as I said early on, if this is something that is causing distress for you when we talk about suicide, feel free to step away and then come back in the next few minutes. But it's important to talk about suicide, just like it's important to talk about mental health, because this is something that has touched all of our lives in some way, whether it's in our personal lives or within the community or just in the world. When we define suicide, this is death caused by injuring oneself with the intent to die. A suicide attempt is when someone harms themselves with an intent to die, but they do not. It's also important that whenever we talk about this topic, we are using non-stigmatizing language. Oftentimes, the general terminology for suicide is to say phrases like committed suicide or successful suicide. We really want to shift that language to say died by suicide, because when we say words like committed, it has a very negative connotation, and it's indicating that someone has committed a crime or committed a sin or done something wrong. And we need to talk about mental health problems and illnesses, just like we do physical health conditions. So for example, we would say someone died of a heart attack, someone died from cancer. Along that same lines, we need to say someone died by suicide. So I encourage you all to be very aware of that language whenever we are talking about this, and to shift the language from those old phrases to talking about mental health in general, like physical health conditions. These are some warning signs that we can look out for. There's a common misconception that suicide happens without warning, but oftentimes, the majority of time, there are many signs that that individual is giving us, whether or not maybe we are the person that they are showing that to. In some area of their lives, these signs are presenting themselves. So there are definitely things that we can be aware of and just acknowledge if we are seeing that in individuals. So I won't go through all of them, but things like talking about killing themselves, feeling no reason for living, increased substance use, further withdrawing from activities and friends, also giving away prized possessions. These are just a few examples of potentially an individual having suicidal thoughts and behaviors. So if we are noticing these warning signs, what can we do? One, have an honest conversation and also talk to that person in private. Number 4 here on the left is actually one of the most important things we can do, and something that I encourage everyone to practice, which is asking directly if someone is thinking about suicide. The reason we want to ask that direct question is because it can often feel isolating and shameful to have suicidal thoughts and behaviors. There's another common misconception that asking about suicide is actually putting that idea in an individual's mind, when in fact, it's causing them to feel less alone and kind of a sense of relief that they can talk about what they're going through with you without fear of judgment, without fear of getting in trouble, feeling ashamed, because it's much better to talk about those issues than to allow for that person to continue feeling those things in the dark and feeling like they can't share it with anyone. So it's always important to ask directly if we do notice those warning signs. And again, I do encourage everyone to practice it. It can be uncomfortable, it can be scary, but at the same time, it can potentially save someone's life. So just like we practice CPR for a physical first aid course to be able to save someone's life, we need to practice having these conversations and directly ask about suicide. We should encourage the individual to seek treatment or contact a doctor or therapist, and also avoid debating about the value of life, minimizing their problems. Again, practice listening non-judgmentally and coming from a place of empathy. So while someone's issues or challenges may seem very small or minor to us, it doesn't mean that it's not impacting them in a big way and is not a big deal to them. So we never want to minimize what someone's going through, and just be there for them and let them know that we care. And again, encourage professional help. Also make sure that we let them know that their life matters to us. And again, asking directly about suicide can save someone's life. Also make sure to contact professionals. We should never act alone in situations like this or feel like we are alone in these situations. There are so many resources out there for us to help guide us through times where we are concerned that someone might have suicidal thoughts and behaviors or is at risk. One of those is the National Suicide Prevention Lifeline. I'll be sure to share these slides with you all after the presentation, but I encourage you to save some of these numbers in your phone if you don't have them already. The National Suicide Prevention Lifeline changed to 988 last July. It used to be this really long number that I don't think anyone would be able to remember. But now, just like we know 911, we can now also all know 988. So definitely a number to keep in your phone. Another great lifeline or text line is texting talk to 741-741. You would be immediately connected to a crisis counselor, and both of those services are free. Both of those services are available 24/7. And for the National Suicide Lifeline, they do have interpreters that are able to provide counseling in various languages. So please know that that is a resource. If someone says they are thinking about suicide, we do not want to leave that person unattended. Stay with them until help arrives. Also remove any lethal means. If you yourself cannot stay with them, make sure someone else is with them. And make sure that we are connecting them to that professional care. So whether that be connecting them to mental health services or going to the emergency room, we need to make sure that person is not alone. If you yourself are struggling, also don't wait for someone to reach out. Seeking mental health treatment is necessary and life-saving, and we want to make sure that we are always treating ourselves like we would our loved ones. So again, if you find that you are noticing any of these warning signs, reach out to your mental health professionals, reach out to the lifeline, to the text line. So some of you mentioned self-care earlier as a treatment option, and this is actually a wonderful resource and tool that we should all be utilizing to help take care of our mental health. So this means taking the time to do things that help us live well and improve our physical and mental health. Just like with medication, just like with therapy, there are also misconceptions about self-care. The first one being that it's selfish. So if we are taking time for ourselves, it means that we are not caring about others, when in reality, taking care of ourselves can allow us to feel more energetic, less likely to lash out at our loved ones, and can be one of the healthiest things we do to be that better friend, partner, daughter, parent, etc., to those around us. The other common misconception is that it takes too much time. Everyone here is very busy. We all have a lot to do day to day, and it can even feel stressful trying to take into account planning self-care into our day or making it part of our to-do list. So we don't even want to acknowledge it. But we could do something as simple as making the decision to sleep 30 minutes earlier, or taking a 10-minute power nap, or taking 5 minutes of our day to spend doing our skincare routine in the morning. It doesn't have to take huge chunks of time, and any little bit that we can incorporate into our day can really make big impacts in the long run and over time. There's also a misconception that it's expensive. A lot of times when we think of self-care, we think of things like getting a facial or getting our nails done or going and working out, meaning we need to get a gym membership. But simple things like meditation, if that works for you. Again, going to bed a little bit earlier, going for a 10-minute walk. These are all relatively low or no cost ways that we can incorporate self-care into our day-to-day lives. So I encourage you all, if you don't already, to start thinking about how can I incorporate self-care into my day-to-day routines? So what are some more examples? How can we practice self-care? These are some ways that maybe can give you all inspiration if you don't do them already. But exercise is a great one. If you have a gym membership or you want one, that is one way, but there are also low or no cost options. Again, going for a walk. It could be a workout class, yoga, dancing, any physical activity you do. When we improve our physical health, we are improving our mental health. That is also very closely related to the foods that we eat. So making sure we are getting nourishing meals, avoiding excess sugar and junk food, taking time even to make a home cooked meal could be an act of self-care. We need to try as hard as we can to make sleep a priority. I know that can be difficult. While it is ideal to get 7 to 8 hours every night, even trying to squeeze in those power naps during the day can really make a big difference. Try relaxing activities like meditation, reading a book, gardening. I personally love spending time doing my skincare. So whatever it is that provides you that relaxation, make sure we take time to do that. And then a great one is to stay connected with friends and family, socialize. If we don't have time to go out to dinner or meet up with girlfriends or guy friends, take that morning commute to work to talk on the phone with your mom or catch up with one of your friends, or maybe FaceTime with loved ones while you're cooking dinner and multitask. But there are a lot of ways to stay connected with our loved ones. Volunteering is also a great way to bring a sense of fulfillment and relaxation as well, and can be a method of self-care. And then also, if you are spiritual or religious, engaging in activities like going to church or other religious services with family and friends. Journaling, yeah, thank you, Shilpa, that's a great one. Any other activities listed that are not listed here that you all do? I know someone had mentioned earlier, acupuncture, laughing clubs. Yes, well, keep the junk food in your life for your mental health, just not too much of it. I agree, I need chocolate to feel better. Massages, yeah, these are all really great ideas. So again, it can be overwhelming to try and incorporate self-care into our lives. So start with something small that you can do every day. And you'll really notice a big difference in how that just changes your mindset and your overall feelings. Petting your cats, yeah, spending time with your pets. I love that. Art time, yeah, drawing. Need the energy for, yeah, sometimes we don't have the energy for self-care. Something else that's not on here that I would like to add is watching TV or, finding a new Netflix show to watch, anything like that. Anything can be self-care. Again, it's what is it that is relaxing our minds, and that allows us to then relax our bodies and just feel more balanced. So definitely think about that. I encourage you all. I know I don't think everyone here is from Chicago. That's where I am from, but today it's 78 degrees. So I plan on going and spending some time outside. I encourage you all to find one thing, even if it's just 5-10 minutes, that you can do for self-care. So we're going to practice a relaxation activity together. And this could be your inspiration to do this again, after leaving this workshop. But again, when we are relaxing our body, we relax our mind. Physical and mental health are so interconnected. So self-regulation is how we can be mindful of our body. Trauma and stress increases these feelings of arousal. And when we have those feelings of stress and trauma, our body is perceiving that danger is near. So then we start to tense up, we start to feel this tension in our body as well, the physical reaction. So when we can take the time to relax our body, our mind then gets that signal that it is safer now, the danger has lessened, and then our mind relaxes. So what I want everyone to do is a body scan. So I'll do it with you and demonstrate, but you can do this at home too. Basically what we're doing is we're going to try and hold tension in our body and then release it. So we're going to start with our toes, and we're going to clench our feet and clench our toes together for 5 seconds. So 1, 2, 3, 4, 5, and then release it. Wiggle your toes, shake your legs out, whatever you need to do. And then let's try that again with our fists. So we're going to clench our fists together for 1, 2, 3, 4, 5, and then release. Wiggle our hands, shake our arms out. And you can keep doing this with your whole body. Scrunch your face together and then release it. Hug yourself really tightly and hold as much tension as you can. Release it. Just feel that throughout your entire body. And as you are holding in that tension and then releasing, think about how you feel. How does your body feel? Do you feel that release? How does your mind feel as you are doing these things with the body scan? So that's one activity that we can all practice and do to relieve stress. Another one is somewhat of a meditation exercise. As you can see here on the screen, there is a white dot in the center of that circle. So everyone can focus on that dot, look at that image, and then close our eyes and imagine that white dot in our minds for 5 seconds or as long as we can. There might be other thoughts coming into our minds. We acknowledge that they're there, but we don't pay attention to them. We keep redirecting our focus to that white dot. And then you come back and you open your eyes and you think about what are those things that were coming into your mind that you were trying to push away. What were you thinking about? When you kept redirecting your focus to the white dot, what changed? How did your feelings change? I'm going to teach one more, which is a breathing exercise. Very simple, but we breathe in for 4 counts. We hold our breath for 4 counts and release for 4 counts. So similar to the body scan, it's this act of gathering up all of that tension that we're holding and then releasing. So we breathe in for 1, 2, 3, 4, hold, 2, 3, 4, and then you release 2, 3, 4. These are all very simple and very quick activities. You could do it one time. You could do it again for 5 minutes or 10 or however long, but it's a way to calm those thoughts, to send those signals to our mind that the danger has lessened, and to allow our mind to relax. So again, relaxing the body relaxes the mind. I love using this analogy with everyone when it comes to mental health. Here I say, especially for parents, because I feel like parents are always thinking about their kids, everyone else in their lives, putting themselves last. But for whoever it is, whether you're a parent or not, put your own mask on first. So when you're in an airplane and they're going over the safety instructions, the first thing that they say is when there's an emergency and the masks drop down, put your mask on before assisting others. We need to make sure that we are prioritizing our own mental health, because when we are doing well, we can then better take care of others and our loved ones. When our mental health is declining, we cannot be that support system for others. So it is not selfish. It is actually very beneficial and selfless to take care of our mental health. I want to wrap up by quickly telling you all about the resources that we have available. Again, this is additional information that you can download that is free, and it's a great educational tool, not only for you to learn more about mental health, but to teach others around you about mental health and just start that conversation. So we developed community resource guides. These have been culturally tailored for the various Asian communities that we work with. We have them in both English and Asian languages. So we have South Asian guides that are available in Hindi, Urdu, and Farsi. We have a Laotian guide for the Lao community. We have the Chinese resource guides, as well as Korean guides that are currently available. And I can also put the link in from our website as well. Let me do that. But these are all free to download and use. They have a lot of the information that I covered with you all today. It also has a directory of resources that you can utilize, both national and local. So these resource guides were developed with the intention of serving the AAPI community in the greater Chicago area. However, a lot of the resources included in there are also national and can be utilized by anyone. So I encourage you to look through those. There's a story about mental health at the beginning that introduces the topic, more in-depth information about various mental health disorders, information about mental health treatment and mental health professionals. And again, like I said, a directory of resources where people can find support. The Asian Health Coalition also offers mental health first aid trainings. So these are skill-based trainings that basically teach people how to identify and recognize signs and symptoms of mental health challenges and substance use challenges and connect them to care. So think about it like this workshop, but it is a more intensive training that happens usually over the course of a day or 2 half days. There's also a specific training that we offer that's focused on teaching adults how to recognize signs and symptoms of mental health challenges in youth specifically. So if you are interested in those, we offer them. They're free. They're run either in person or virtual. And again, it's just another tool to utilize to better be able to help those around us and connect people to care. And you do receive a certification for taking this course. So I'd be happy to look into if there are resources specifically in New York. I'm sure there are lots of organizations that have created guides. But again, these resource guides that we have can be utilized by anyone. I would say 90% of the guide is just talking about mental health generally. It's the directory at the end that we have developed that is specific to the city of Chicago. But I encourage you all to download the guides and still use them, as a great resource. But if I can find anything with local resources for New York, I'll be sure to share that with Jamie and Annie and the team. Yeah, I see people are already putting in other questions as well, so feel free to keep putting in questions and I can answer them at this time. Yes, you can go ahead and print them. Again, they all can be downloaded from our website and you can distribute them free to download and utilize. Thank you, Neil. Thank you so much for attending. This is an example of some of the resources that are in our directory. So as you can see here, there are some things that are specific to the city of Chicago and Illinois, but there are also all of the national lifelines and resources. On this right-hand side, you see the Substance Abuse and Mental Health Service Administration Provider Locator. This is a really great resource for anyone to use because you basically type in your zip code and then it'll show a bunch of the mental health and substance use service providers in your area that are closest to you. So that can be utilized no matter what your location is. And then again, on the right-hand side, you see all of the national lifelines, text lines that you can use. This is my contact information and all of the links again to the resource guides as well as our general website. I encourage you to take a look at the other behavioral health programs we are running. If you and your organization are interested in attending a mental health first aid training, again, those are free. Myself and 3 other colleagues are certified instructors. We'd be happy to provide trainings to you all. So that is the email that you would use to sign up for that. Again, I'll be sure to share the slides. Yes, we do those virtually. We are also working on offering them in person, but again, we're located in Chicago, so that is where the in-person trainings would be. But for the past couple of years since we started doing the trainings, they've all been over Zoom. Any other questions? If anything comes to mind later, or as you're looking through the resource guide or the slides I send out, feel free to send me an email. I'm happy to get back to you. Yeah, I see some other resources being put in the chat box. That's great. There are so many things out there that we can utilize and that are specific to the AAPI community. If there are no other questions, I will go ahead and stop sharing my screen. But thank you all again so much for this opportunity. And it was really great meeting you all.
Yes, thank you so much, Nishita, for this really wonderful, informative presentation. For everyone, we will be sending the recording to the listserv as well as slides. And again, please join me in thanking Nishita for her time.
Thank you so much, everyone.